When I started in practice was about 1985. I began seeing some patients who had some unusual presentations with basically fatigue, for which I really didn't have a good answer for. About that time was when there was a paper that came out in one of the medical journals that was published by Dr. Peterson and Dr. Bell, and they talked about this illness which they, at that time, were looking at as possibly secondary to mono or Epstein-Barr virus. So I called them and asked them a little bit about what was going on and what they were thinking. And at that time I was practicing in Chicago, and with that information I began treating some of my patients with what they had found out. I remember my first patient, again, back in 1985, and she had come in with this complaints of debilitating fatigue, couldn't understand what was going on and why she felt this way. And I put her through a zillion different tests, looking for all possible causes of her fatigue. Couldn't find anything that I could find by blood tests. In addition to that, put her through psychiatric testing. She saw a psychiatrist, and again, nothing there. And that's when I said, I have to find out what this is. And that's when that article came out in one of the journals about people with this chronic fatigue, which was not really explainable. At that time, there were these two outbreaks. One was in Nevada, one was in New York, which were being studied by Dr. Peterson at Nevada and Dr. Bell at New York. It was fortuitous. At that time, I actually had somebody to talk to about this. Before that, there was nobody else to talk to. If you look at the physicians who were at the forefront of chronic ME/CFS back in 1985, when this really blew up, so to speak, we're getting older. And many of these physicians already retired. The worry that I have, as well as the other physicians within the ME/CFS community, is that who's going to pick up the mantle and who's going to be out there to diagnose and treat these patients. Part of my role, at least part of my undertaking, has been to try and see how we can get younger physicians, the newer graduates, involved and interested in this. In my practice, every day I have at least 2 medical students with me, and these are medical students who've been sort of brainwashed, if you will, by the medical school, in that patients with ME/CFS, it's a non-disease, fibromyalgia, non-disease, and therefore they don't really spend much time on it. When they come to my office, they see these patients who are significantly ill because of their illnesses, the ME/CFS and the fibromyalgia. The benefit they have is, one, they see how disabled these people are, but the other benefit is that they see patients who come in who are actually better. It's gratifying for me to see these patients better, but it's also gratifying for me to see that the students are actually learning that this is a real process, it's a real problem, and these people need to be taken care of. That's our commitment, to take care of people. And to dismiss these illnesses as not real is a disservice to your patients as a whole. So part of what I'm doing now is I am involved with Quinnipiac University, the Frank Netter Medical School, which, and that medical school is committed to having their students come out and practice primary care medicine. So I've been involved with them in setting up a curriculum which will have ME/CFS and fibromyalgia as part of the curriculum, a major part of the curriculum, not just something that's a paragraph or two during the curriculum. We've set up a program where there'll be an actor who has chronic fatigue syndrome and or fibromyalgia, who will be in the simulated examination room, that is, with patients, so they can learn more about this illness. We're also starting to look at a lecture series for the medical students as far as ME/CFS and fibromyalgia goes as well, an ongoing lecture series as well. And we're going to probably be bringing in from around the country several of the thought leaders in ME/CFS. This is the only places that I know of that it's being done in the United States, and the hope is, if it's successful here, then we can introduce it into other medical schools around the country. I think it's necessary. I think it's important work. And as the research comes along and gets stronger, then I think the other medical schools will follow suit. But as long as we show we have a track record, I think that'll make it a lot easier. There seems to be a strong push now and a strong commitment now from government agencies as well as private agencies in putting money into valid research which would hopefully, and that looks like would hopefully in the future yield more information that would change the tide in research, as well as possibly finding an etiological agent, as well as then obviously finding a treatment for the disorder.